Good afternoon, respected teachers and my junior colleagues. At the very outset, I must thank API West Bengal chapter, particularly Professor P.S. Karmakar sir and Professor Jyotirmoy Pal sir for bestowing on me the opportunity to speak in front of such an august gathering on such a pertinent topic. I have been asked to speak on Osmo technology and its role in diabetes mellitus. Well, oral route has always been the most common and widely utilized route of drug administration. The reasons being the ease of administration, better patient cost acceptance, and cost-effective manufacturing process. It is almost often regarded as the most natural and uncomplicated and convenient and safe method of drug delivery system. Lots of research is going on the development of controlled release drug release system as existing oral drug delivery system at some pharmacokinetic limitations. In fact, the immediate release dosage forms definitely have some limitations. So the there are many swarm of drug delivery systems available, of which Osmo technology, which will be discussed over the next few minutes, is the most popular such technology. Controlled drug release systems are capable of controlling the release of drug delivery, thereby sustaining the duration of therapeutic activity. Though various technologies are used in drug formulations to control the rate of drug delivery, it seems in achieving delayed drug delivery, few technologies differ from other technologies, making each of the technologies unique in their own sets. Different technologies used in extended release formulations definitely has some advantages over conventional extended release formulations, which have, as I was discussing, some unpredictable pharmacokinetic and pharmacodynamic limitations. That is the unpredictable plasma concentration, interference with drug release by the gastric pH and food, resulting in a swarm of adverse effects. Osmo laser technology is the most popular of the recent, which overcomes these challenges, and it's a novel technology of drug delivery. Osmo technology, osmosis-mediated oral drug delivery system technology, is researched for diabetes care. In this context, I must say that this novel technology has already been implemented in cardiology section for nifedipine and verapamil, in neurology section, as well as in diabetology section for glipizide in the United States of America. But in our country, this is the first time it has been applied in the diabetes basket, like metformin or vildagliptin metformin combination, which I will come later on. So what are the advantages of this unique Osmo laser technology? The drug release is independent of gastric motility, pH, or food, thereby minimizing the fluctuations and increasing the oral bioavailability of the drug. It provides the delivery rate of zero order, and delivery may be delayed or pulse if the situation demands, and thereby achieves a higher and predictable release rates and higher degree of in vivo or in vitro correlation. So how does this Osmo technology work? As we all know, osmosis is driven by a semi-permeable membrane with a difference in the a difference between the two layers. And this Osmo laser technology, as the graph is, as the pic shows, it has an overcoat of drug where the drug comes in contact with the gastrointestinal fluid, and the outer layer of glimepiride dissolves, giving a rapid initial release of glimepiride, resulting in a faster onset of action. It has a semi-permeable membrane through which osmosis occurs, and there is a laser drilled hole through which metformin moves outside through this laser drilled hole in a controlled rate, thereby minimizing the gastric side effects and prolonging the duration of action. And among the metformin layer, there is a swellable push layer which starts expanding, pushing metformin through the laser drilled hole. And this is the layer in red is the proper metformin layer. So currently, this has been utilized for metformin. However, these technological differences in controlled release drug delivery system results in different clinical outcomes. Innovative Osmo laser technology has definitely been incorporated, as I was saying, into the glimepiride metformin combination for achieving early as well as prolonged and durable glycemic control, as well as the glucose safety part, that is the overcoming the notorious GI adverse effects of metformin, which often results in poor treatment adherence, thereby failing to achieve the glycemic target. As we all know, metformin remains the poor man's meat, And in all the August guidelines by all the professional druggists, metformin has clearly been recommended as the first drug to commence if lifestyle modification fail. However, it has been associated with a swarm of adverse effects, resulting in challenges in clinical practice, challenges to commence, challenges to continue the treatment. If you see, the predominant side effects of metformin, which we so often encounter in our patients, each and everyone in our day-to-day practice, are the gastrointestinal side effects. And this slide clearly shows that 62% of patients suffer from diarrhea, 52% from heartburn, 47% from nausea, 36% of abdominal pain, 35% from bloating, and 21% from retching. In fact, 71.7% reported at least one tolerability issue on commencement of metformin therapy. And even 62% patients suffer GI side effects in combination with metformin. This results in difficulty in gradual up titration. This results in poor adherence to treatment and thereby poor glycemic control. And if you see, the patients with type 2 diabetes mellitus taking metformin have the lowest adherence. Here is a study which clearly states that of all the oral medicines, be it the DPP-4 inhibitors, be it the SGLT2 inhibitors, be it the glimepiride or the sulfonylurea as a class, or even the thiazolidine inhibitors, metformin remains one of the most common drugs with the lowest adherence courtesy its adverse effects, because it's the poor man's meat. It's the cheapest drug encountered and it is so very pertinent in a developing country like India, where one has to bear from one's own pocket. But in fact, 30% of the doses of metformin were not taken by patients to which they were prescribed. And this results in poor glycemic control. In fact, studies have clearly shown that adherence to drug is almost equal to adding a second drug. So our aim of therapy should definitely be to ensure that the patient adheres to the drug through by giving such a prescription which has the least of side effects. And what are the consequences of non-adherence? It will definitely increase the mortality and morbidity. It will increase or it will rather than delaying the microvascular or macrovascular complication, it will help in early approachment of the same, or it will not prevent the augmentation of the microvascular and macrovascular complication. The net results: increased cost of outpatient care, emergency room visit, emergency hospitalization, and management of the microvascular and macrovascular complications of diabetes. In fact, at least 45% of patients fail to achieve the glycemic control, that is the target A1C of 7%, due to poor adherence. So what are the consequences? Increase in the mortality to the tune of 45%, increase in atherosclerotic cardiovascular disease to the tune of 41%, increase in the hospitalization to 35%. Similarly, it applies for the microvascular complications as well, to the tune of 85% of nephropathy and 98% of retinopathy. So the impact of non-adherence on mortality outcomes as shown in this wonderful study published in Diabetes Care, which clearly shows that in non-adherence to anti-diabetic medication results in the increase in 1.6-fold in the all-cause mortality rate. And therefore, improved medication adherence definitely matters, and it should be one of our primary targets to ensure that the patient adheres to the prescription, because 10% increase in complication reduces the glycated hemoglobin to the tune of 0.1 percentage points and reduces the annual healthcare cost to the tune of 29%. And that will help in minimizing or preventing 240 deaths out of 10,000 individuals, and including 152 atherosclerotic cardiovascular deaths. In fact, studies have clearly said that high level of adherence is as effective as addition of a second add-on drug in achieving your target glycemic control. And this novel Osmo laser technology has really made our life easier by a predictable drug release with a 30% lower Cmax, sustained plasma concentration for a prolonged period of time, thereby increasing the duration of action. And this has been amplified by a combination of glimepiride immediate release and metformin sustained release technology. And courtesy this technology, there occurs lesser gastrointestinal side effect, so we can smoothly up titrate the dose of metformin up to 2 grams per day if the situation warrants, resulting in an earlier and prolonged glycemic control concept of metabolic memory, thereby preventing the development of microvascular and macrovascular complications or retarding the same if it has already developed. And the net result is improved medication adherence and achieving the target glycemic control and maintaining the same over a span of time. Here is a review article on this Osmo technology or osmotic controlled drug delivery system and its impact on diabetes care by Dr. Rajesh Rajput and his team. And it clearly reiterates the fact that the Osmo technology is the most promising strategy-based system for a sustained drug delivery. And this technology offers distinct clinical advantages to patients of type 2 diabetes mellitus by ensuring a predictable therapeutic plasma concentration, resulting in minimizing the adverse effects and prolonging the duration of action, thereby preventing treatment dropout and improving patient adherence. In fact, in chronic kidney disease or diabetic kidney disease remains one of the important microvascular complications of diabetes, which is so commonly encountered in our clinical practice. And unlike linagliptin, which Dr. Panda has illuminated in his very writing lecture today morning, vildagliptin requires a dose modification to tune of 50 milligram once daily. And courtesy this dose of modification, it will not achieve the maximal DPP4 inhibitors of 12 hours. And this elicits submaximal trough over a period of time. So patients on 50 milligram once daily vildagliptin are definitely deprived of prolonged DPP4 DPP4 inhibition. But courtesy this unique technology with the sustained release of vildagliptin with Osmo laser technology, prolonged DPP4 inhibition with once daily sustained release over a period of 20 years, 20 hours can be achieved in contrast to the 13 hours with the conventional vildagliptin 50 milligram once daily or twice daily, which we commonly use in our clinical practice. Not only that, vildagliptin 100 milligram sustained release is also in the pipeline, courtesy this unique technology. And if you see, this clearly shows that compared to the innovator brand in vildagliptin twice daily, vildagliptin once daily achieves 80% DPP4 inhibition over a span of 23 hours, which is almost similar to the innovator vildagliptin 50 milligram twice daily. Therefore, reducing the burden for a patient compliance. So improved safety, improved glycemic control with less pill count. But what can we ask for more? Because polypharmacy is inevitable with elderly, and reducing the pill count can do wonders in reducing the not only the physical ailments, but also the mental or psychological ailment of our diabetic patients. So our target A1C can definitely be achieved with vildagliptin 100 milligram sustained release compared to 2 milligram vildagliptin 2 tablets of 50 milligram immediate release.
Dr. Siddhanta,
yes, sir?
Wind up. Please wind
okay, sir, I have two slides are left. So it reduces the drug exposure with the lower Cmax with improved safety profile. So to summarize, osmotic laser technology is the most promising strategic technology for sustained delivery of drug. It definitely overcomes the limitations of conventional extended release formulation by virtue of the distinguished technological features. The lesser GI side effects with this unique Osmo laser technology will definitely have a beneficial role in improving patients' adherence to metformin therapy. And courtesy this novel system, it will help to deliver the drug in a controlled manner, providing predictable and stable plasma concentration, resulting in lesser adverse effects and prolonging the duration of action, thereby improving patient adherence. Thank you all for your patient hearing.